Hello, and welcome to my presentation, which aims to explore my identity as a reflective educator. My journey as a reflective educator has largely been shaped by my changing definition of what it means to learn and what it means to teach. This will be discussed in my presentation, along with my past experience of reflective practice, a critical appraisal of sorts of some of the models I've used in the past for reflective practice, and also I'll be presenting an action plan which I plan to use to progress further in the future as a reflective educator. Firstly, what learning has, and now presently does, mean to me. Early in my education, I was more of a blank canvas. I did not have any pronounced interests or more understanding of one subject over another, meaning that rote learning took a great deal of precedence in my studying. For example, copying words out in spelling books to learn their spelling, or using abacus to learn maths. Using these study skills was laborious, but ultimately successful, and it was done as a necessity, as lack of motivation was punishable by personal or parental disappointment. Pedagogical principles refer to the study of teaching and can inform an approach to transmitting education to students, particularly children. Bernstein described three message systems. 1. Curriculum, the selection of knowledge. 2. Pedagogy, how the information is transmitted. And 3. Evaluation, assessment of knowledge gained. However, these principles do not consider the past experiences of the learner or their intrinsic drives. This is considered more in andragogy and adult learning theories. During my formative years in college, my goal was simple: achieve A grades in all my chosen subjects so that I might earn a fighting chance in the applications process for med school. I felt the onus was ultimately on me to study and be successful in these assessments. This form of self-driven learning would complement the andragogic form of learning, with educators acting more as facilitators in the process and the model being found on 6 principles as described by Knowles and Company in The Adult Learner as 1. Learners need to know the content. 2. Self-content of the learner. 3. Prior experience of the learner. 4. Readiness to learn. 5. Orientation to learning. And 6. Motivation to learn. These principles may be used to build effective learning process for adults, and it's a great strength of the model that is flexible for all adult learning situations. The model's underlying assumptions make it open to criticism, however. For example, it is asserted by Hartree and Company that whilst in the adult learner, that the individual adult has a deep psychological need to be perceived by others as self-directing, this nurtures the self-content principle of the model, this does not necessarily mean that the learner actually is or wants to be self-directing, and poses the important question as to whether the model is intended to be prescriptive or descriptive, and whether these principles act as goals or preconditions for effective learning. Personally, I feel it's more of a prescriptive model, as it appears to be that these principles resemble ideal states rather than explanations for effective learning. This theory, like other adult learning models, is not a unified theory, but is more to me a philosophical concept which is centered on an individual learner and their ideal state for learning. To its credit, there is no all-encompassing learning theory, but for more discrete psychological concepts and models which include mention of the learning process, then we must look elsewhere. Other models can be studied, which further progresses the notions of a teacher having an active role in facilitating learning and providing safety for their students. By shifting perspectives from focusing on the attributes of an individual learner to what we perceive as the teaching organization's role, we begin to appreciate other factors behind effective adult learning and teaching. Knowles and Company, whilst presenting the learner-centered concept of andragogy, also asserts, aside from the misconception that organizations exist purely to get things done, that they also have a role in society for helping people achieve their goals and meet their needs. I feel this is particularly relevant for university students, who generally move from the safety provided from their family unit to campuses where their pastoral needs are being maintained independently with or without institutional aid. Intrinsic motivation is further scrutinized by theories such as Maslow's hierarchy of needs, which considers the need to meet the lower needs, example nutrition or safety at home, prior to achieving higher needs such as self-actualization. Nito highlights in her paper the following 2 implications of these needs for educational motivation. The first being that successful students are those who have a deep understanding of what drives them intrinsically and marries their internal drives to an activity. And the second being that the motivation and effects of self-actualization repurposes educators as facilitators of future communities and individuals' skill sets to contribute to the needs of the community. As an educator, I would initially view higher needs such as self-actualization as being difficult to promote, but would suppose that a teaching session, which allows for the free expression of students, would encourage reflection and autonomy, and potentially reveal and map their internal drives to the activity. This could be done by exploring students' assumptions and expectations behind what they are to learn, and what can be achieved through the acquired knowledge. An example of this would be the fact that it took me a long time to develop confidence and competency in driving a car because I had a crippling anxiety of stalling that car. It was only after my teacher and I explored how and why cars stall, what to do when they do stall, accepting at my early stage of learning I would inevitably stall, and actually experiencing stalling the car with him by my side, directing me what to do, did I make significant progress in learning to drive a car. Just as that teacher had done for me, I similarly explore the ideas, concerns, and expectations of patients that I meet in everyday practice so that I can break down psychological barriers which could prevent them from learning about their conditions. I would consider it useful to do so with students as well, prior to teaching sessions. Throughout the course of my education, I've taken both a surface and a deep approach to learning, to subjects that I've had a lower and higher level of degree in respectively. Biggs and Tang define surface learning as learning activities that are too low a level to achieve the intended learning outcomes, and that the deep approach arises from a felt need to engage the task appropriately and meaningfully so that the student tries to use the most appropriate cognitive activities for handling it. Factors which seem to promote surface learning are also elaborated on, which can include various factors from the student's perspective, of failure to balance time against their workload, anxiety, wanting to only achieve a minimal pass, a cynical view of the subject, and or actually being unable to achieve a deep understanding of the subject, and limited teaching methods, for example, rote learning as discussed earlier, and also over-reliance on bullet points, covering a wide scope of topics at the expense of depth, and also the teacher themselves expressing cynicism for the subject. Teaching methods which promote a deeper learning include exploration of the subject in a structured way, rather than addressing individual facts, building upon what the learner already knows, addressing students' assumptions and confronting misconceptions, as we discussed earlier, and encouraging a positive learning environment, exploring depth rather than breadth of the subject, and using assessment methods which address the learning outcomes. If one is to consider the motivations, assumptions, and perceptions of students, it is worth considering the implications of the promotion of equality and diversity amongst the learner population. Altbach and Company suggests that increased participation, referred to as massification, is associated with an overall lowering of academic standards, as universities and student populations become yet more diversified. To me, whilst this may be welcoming as an opportunity to teach students from varied backgrounds to promote equality, as it is a belief of mine that people should not be at a disadvantage in gaining opportunities to participate in higher education due to cultural or financial reasons, this also does impose the challenge of teaching a greater proportion of students who may be of a lower academic ability, those who are less motivated, or even those with cultural attitudes at odds with a Western mentality. Those of lower ability should be encouraged as appropriate with their needs addressed, but I feel it is significantly harder to teach those who may be attending university with an agenda not in keeping with their personal ambitions, for example, those who enroll purely due to parental pressure. When I consider how these factors influence my approach to teaching, I consider that those of lesser academic ability will require a greater number of activities in their teaching in order to engage them with new concepts, meeting their learning outcomes from memorizing to theorizing, and those who are less motivated may be better suited to learn from succinct passages of knowledge, as they may wish to only learn what is needed for them to pass their assessments. The overall greater level of activity in teaching is a principle behind the increased pressures of institutions with increased student participation. If you were to ask me now, what is learning? I would say that learning is personal growth. And this idea could be explored with constructivism, which is a concept which conforms to the principle of teaching and which learners build their knowledge of what they already understand and interpret new concepts via pre-existing cognitive schema, accommodation and assimilation. This theory is founded on the principles of cognitive psychology and date back to the work of Piaget, which challenged the idea that intelligence is a fixed trait, but rather that individuals develop cognitively as children through a progressive reorganization of mental maturation and environmental experience. Practically, this requires engagement from the student so that the information can be attained with a personal context added to it, either from previous experience or via the activity for which it's being learnt. The student reflects on what is being presented to them and can build upon their knowledge base by making their personal inquiries. Bauer and Company define reflective practice as the intellectual and affective activities in which individuals engage to explore their experiences in order to lead to new understandings and appreciations, with the outcome of it being a personal synthesis, validation of personal knowledge, a new affective state, or the decision to engage in further activity. These statements to me make clear the mission statement of reflective learning, and is further illustrated in the figure below. My first exercise in reflective practice was as a medical student, making entries in my portfolio, recounting and synthesizing action plans based on significant clinical encounters during my placements. Reflective practice has been scrutinized in literature. For example, a systematic review by Mann and Company looked at studies of reflective practices utilized by various cohorts, including medical students, nurse practitioners, and general practitioners, and suggested that whilst there is limited evidence to suggest that it actually enhances competence, for example, there is no evidence that it improves patient care, it is purported that the literature does suggest a deep approach and reflection seem integrally related and mutually enhancing. As a medical student, I found reflective practice to have been useful in improving my confidence, so at least I felt a greater psychological competence with tasks. It is important, however, to address the criticisms and limitations of reflective practice. The adoption of reflective learning of a workforce in an institution faces numerous barriers, such as the added burden of time and increase in their workload. And if practiced via mandatory assignments, such as in my medical school portfolio, then it may lead to a faking or hating of the reflective process, as asserted by Hobbes in stating that creating a forced reflective practice assignment that evokes genuine and uninhibited response is nearly impossible. Dr. Philip Dawson of Monash University has produced an informative lecture available on YouTube, during which he shares useful literary resources, including those cited in my presentation, and his criticisms of reflective practice. This highlights one especially important limitation of reflection which really resonates with me, and that is that it is this. It can be a one-sided conversation, effectively an echo chamber, for which a person's experience is only being reviewed through their own perspective, which of course holds potential for bias and limited insight. It is also suggested that some adjuncts to individual practice can be made to counter this, including the role of scholarly input, such as the consultation of literature, as cited in this presentation, and the use of peer learning groups. The first model I became acquainted with for reflective practice was Gibbs' reflective cycle, and it served as a good introduction to reflection and is a model I've used most extensively in the past. The components of the cycle are shown in the figure below. This cycle is useful for becoming accustomed with the principles of reflective practice, as it has numerous steps to provoke review of a learning event. However, I find that it is largely serving of more of a debrief of a situation and is less succinct in critically appraising feelings and actions. Personally, I feel that the processing of events via this cycle can be muddied by the feelings and analysis steps, which appear to demand an affective and logical deconstruction of events separately. Whilst this is useful when grasping the concepts of reflecting as a beginner, I feel that this results in unnecessary recounting of the events. I would instead prefer a model which allows for processing of affective and logical components of an event as the situation is recounted in one go. Kolb's reflective cycle is a more concise model and is featured in the figure below. I appreciate that there are fewer steps in Gibbs' cycle. However, I feel that these steps may facilitate a superficial approach to learning, as there are few descriptors to provoke critical thinking and less is demanded from the learner. So here we come to Rolf's minimal model, and this facilitates reflection by processing an event with three main inquiries. First, what? What was your role in the situation? What actions were taken? What aims were achieved? What were the response of others? What feelings were involved? And what were the consequences for those involved? So what? The thoughts and feelings behind the actions, what could have been done better, and what new understanding is found? And then, now what? What could be done to achieve improvement? The consequences of the action plan is successful. When I reflect internally on events that have occurred, I tend to do so with a structure resembling Rolf's model. I like that it is relatively succinct compared to other models and has a logical order to it, a form of past, present and future process of thoughts. It allows for the logical and affective concepts to be expressed. Also, while the three concepts are simple, they allow for critical thinking by prompting a challenge as to the broader issues and implications of their actions and plans, rather than other models whose components appear to only demand a description of elements of the reflective event. This model can be superficial, being succinct, and can act as a whistle-stop tour through the event of sorts, so in less experienced reflectors, the gains may be minimal. So now we come to my definition of what it means to teach. Now, if you ask me in my early education, what is teaching? I would say that the teaching is simply the transmission of knowledge from teacher to student. Biggs and Tang describe three levels of teaching, which I feel encompass my evolving definition of teaching from level 1, which was informed primarily by my experiences as a learner. Level 2, informed by my construction of teaching skills and reflective practice. And now Level 3, which I aspire to focus on via application of transformative learning and constructive alignment via an identified disorienting dilemma, which I'll elaborate on later. Mesereau's transformative learning is defined as learning that transforms problematic frames of reference to make them more inclusive, discriminating, reflective, open, and emotionally able to change. This helps take reflection in another direction for me, as it concentrates the process of a disorienting dilemma, an issue in which one's current perspective has a limited ability to resolve and requires transformation in order to carry out a new strategy, as opposed to reflective models which purely utilize current experience. So now for my disorientating dilemma. Upon reviewing teaching feedback forms completed by students following my most recent teaching session, I've faced a disconcerting revelation. Over the past year, I've had very little experience as to whether my students had actually learned what was intended by the session. Whilst I'd been developing some traits of facilitating a session, such as my presentation skills, ability to put together a slide presentation, and time management skills, I could not be certain as to whether students had absorbed the content of the session, and so could not be certain of this when I was measuring the outcomes of gain of knowledge. I have regarded this as my own disorientating dilemma and have applied transformative learning to develop a strategy to address this. So firstly, I reflected on the problem using Rolf's model. Please pause the presentation and review the figure. Done? Right. So next we'll have a look at the feedback form I routinely use for my teaching sessions. I feel it needs revision, as whilst it allows students to reflect on the purposes or ILOs of the sessions and freely express feedback, it does not adequately provoke the student to be critical of whether the outcomes have been achieved. And I feel the addition of direct and closed questions such as, was there anything else you'd like to have covered? What were the strengths and weaknesses of the session? Or even, what was the most difficult ILO to achieve and why? Would allow for a better idea if outcomes were actually being achieved based on student feedback. I feel I have limited experience in assessing a learner's knowledge, so my options for choosing an assessment method were limited, meaning I'm in need of a perspective transformation. I need to access resources to expand my perspective, informing a new means of assessing students' knowledge gained from my sessions. Biggs and Tang have introduced to me constructive alignment, which emphasises a harmonious relationship between learning objectives, teaching activities, and assessments, with learning to meet outcomes rather than topics. This is appealing as the outcomes should be designed to be significant to what students ought to know, with a discrete quantity of depth of content needed to achieve it, making it easier to measure. It would be folly to design assessments for ILOs without being confident that the outcomes themselves are appropriate to begin with. In supporting constructive alignment, there are 6 goals for constructing outcomes which were identified by Angelo and Cross and are as follows. Number 1, goals for higher order thinking skills. 2, basic academic success skills. 3, discipline-specific knowledge and skills. 4, liberal arts and academic values. 5, work and career development goals. And 6, goals for personal development. I feel I can produce outcomes with some pertinence to these principles, and these are my own personal rules for worthy outcomes. 1, they should be meeting the needs of the learner's educational curriculum and their formal assessments. 2, they should be exploring the subject in a structured way rather than individual facts and promote a deeper appreciation of the subject. 3, they should explore the implications and relevance of the knowledge or increase competency, i.e. what can they now do following the session. And 4, relevance of the content to being a doctor, as I'm teaching medical students primarily, and to society as a whole. For example, what is the burden of a disease that we are learning? And what can we do to better empathise with the patient experiencing these conditions? A variety of teaching learning activities can be used to achieve the ILOs and incorporate various teaching methods and facilitate an immersive teaching experience rather than a rigid sage on a stage lecture format, which I try to avoid. Activities I could utilise to try and produce an experience include case-based learning. These can help to introduce patients to conditions with a guided approach which has the potential to be non-linear, as the discussion can be open to the floor to discuss differentials and clinical decisions that could be proposed by the students. Group work. This could allow for elaboration, creative work, and application of knowledge, for example, in data interpretation. These groups should be small enough to avoid over-socialising, and a jigsaw approach could be made, with each group doing tasks covering different aspects of the content. For example, one group interpreting ECGs, another X-rays, and another blood results. Workplace activities, for example, observing and assessing students' ability to perform tasks during bedside teaching and offering feedback on their practice. These activities could also be bolstered in value by encouraging the learner to reflect and give themselves feedback, but also for me to give them feedback at the time. These activities encourage students to demonstrate their understanding of content during the session, so could also form part of the assessment process to review whether outcomes are being achieved. In addition, I've considered the use of multiple choice questions or MCQs at the end of teaching sessions in order to assess what knowledge has been gained by students. However, there is the practical challenge of implementing an assessment, as time is needed for the students to complete the quiz, for it to be marked, and ideally for a review of the questions most commonly answered incorrectly and allow for revision of facts of information poorly recalled. However, I am very grateful to be introduced to a resource via a peer learning group, which was formed in the process of my enrolment in the Medical Education PG Cert course. I have learned of a web-based resource called Kahoot, which generates a web page code which students can access via their phones to complete an MCQ-based quiz, with the results compiled and presented automatically afterwards. In teaching sessions, I have had some apprehension in using various technology, as I am anxious of its potential to fail. But I have trialled this resource and have identified some advantages and disadvantages. Advantages include that it would allow for time-effective review of learned content, but there is a disadvantage that it's quite resource heavy, as it requires a Wi-Fi connection and devices for students to access the quiz. However, I usually teach in lecture theatres with good internet coverage, and I teach medical students who are routinely supplied with iPads. However, this could also promote procrastination and mobile phones being used for causes other than the session. This could be overcome by preparing a backup paper-based quiz in case the resources are not available, and by holding the quiz at the end of the session so that learning is not disrupted. Success in using this assessment method could lend itself to a perspective transformation of mine with a greater embrace of technology in the future. Here you can see an action plan derived from these considerations. Please pause the video and take a look. I intend to treat these implementations as experiments and collect data as such via assessment results, feedback forms and reflective pieces in a teaching portfolio, and share my findings with my peers for evaluation and further suggestions pertaining to any difficulties I may have found implementing ILOs, activities, or assessment methods. This leads me now to what I consider teaching to be. Currently, I feel that to teach is to change a learner's perspective and better realise their ambitions. This is the product of my journey as a reflective educator so far, and I feel this has been shaped primarily by my experience as a learner, in which I've gained empathy to get insight into their perspective, my early teaching experience, which I've gained insight to my own abilities, particularly through reflective practice, me applying transformative learning to more recently change my perspective, and my practice, for example, being able to assess knowledge gained by my students more appropriately from sessions. And I will also be moving to carrying out my action plan so I can practice more constructive alignment and fulfill my own definition of teaching to change my students' perspectives and practice so they can better realise their ambitions. My journey as an educator is not over. It will continue. As I'm eager to develop my abilities, it will involve a cycle of preparing teaching sessions, gaining feedback from students, reflective practice, and using resources such as literature and the exchanging of ideas with a community of educators to further transform my practice and perspective, and continually collecting data from these experiments I carry out, and reflecting upon this. It is a lifelong dynamic process. It is an art. Thank you very much. See you later, educators.